Welcome to the Java Cafe, Java fam. Good morning. Welcome to the Java Cafe, Java fam.
Good morning, everybody. Good morning. Good morning. It is Tuesday, April. Tuesday, April. Oh, my goodness. I've been doing so well. Tuesday, April 19th, 2022. Welcome to Java with Jimmy. And today's your Healthy Java. As we've been for the past 6 months coming in, we started out every other week and then we switched to first and third Tuesdays. And so every first and third Tuesday, you can come in the Java Cafe and hear information and updates and be aware of health information through a partnership and support of this segment from the Office of Equity and Community Health at Massachusetts General Hospital. Today, we are talking substance use and addiction. And even y'all know I'm transparent. In the flyer, I'm old school, and from my peer education days and outreach worker days, we would say substance use and abuse. And we're going to get some updates because words matter. And so I am grateful to Dr. Alabre, who is not on screen with us today, but present for his curating these experts that are going to come in this morning and speak with us about updates and trends. On this platform, we've talked about the impact of mass and CAS, but we're going to talk about substance use. We're going to talk about maybe changes and some of our tendency to lean more on substances during the pandemic. We're going to learn that something very popular in our community is technically a substance. And so without further ado, it is my esteemed pleasure to introduce these great folks from Massachusetts General Hospital. They're going to introduce themselves, and we have Dr. Lambert here. We also have Jazz Irvin and also Wendia Rodriguez. And so we're going to have a very open and informative conversation about substances and addiction. And so good morning to each of you. It is a pleasure to have you all here in the Java Cafe. And we will start with Dr. Lambert. If you could introduce yourself, tell us a little bit about yourself, and then we'll go to Wendia and Jazz as well. But good morning to you all.
Good morning. You can hear me?
Yes, we can hear you good, and we can see you as well.
My name is Gene Lambert. I'm an addiction medicine physician at Mass General, but been practicing hospital-based medicine for about 20 years. The majority of my career has been at Mass General. Over the last 5 years, I've done some specialized training in addiction, and now primarily treat patients who are admitted to the hospital with substance use disorders or substance use issues, while they're also confronting their acute medical surgical issues. My expertise is alcohol use disorder, so I'm glad to actually be a part of the panel and hopefully share some of my clinical expertise, my experiential knowledge. On a personal note, I grew up in Mattapan and Hyde Park, still live in those areas and consider myself a resident of Boston. So it is a pleasure to be here connecting with my Black and brown brothers and sisters.
Absolutely, sir. And you've already started the education, and we're going to go into that in a couple of seconds. Wendia, please introduce yourself and tell us a little bit about yourself.
Sure. Hi, everyone. My name is Wendia. I'm a person in long-term recovery. So for me, that means I haven't used drugs or alcohol in over 10 years. And I'm the program manager here at MGH. I've been here for about a year and a half. But before that, I've been a coach at Brigham and Women's and with Always Health Partners. And so I have the experience of the lived experience and also some of the experience of coaching. I call it coaching coaches. and also coaching people who are in the community and of the community. And so I'm like Jean, I grew up in Boston, and I'm really excited to be here to talk about substance use disorder and addiction and recovery.
I am looking forward to hearing from you, and you come, all of you come highly recommended, but Cindy Diggs and Dr. Alabre were ecstatic, and Jazz as well, who's going to introduce herself, about making sure that you take that lived experience and how you've taken your testimony and used it to help people. And so thank you so much for being here. Jazz, I'm a little excited with Jazz because I've known Jazz for a long time, and she is the spouse of someone that I've known since they were like yay big. And so Jazz, please introduce yourself and tell us a little bit about yourself and what you do there at Mass General.
Thanks for having me, Jimmy. I'm Jazz Irvin. I am an administrator here for some of our outpatient substance use disorders clinical operations here. So I'm basically running some programs here. I've been at MGH for 13 years now. You trained me when I came back. When I came back into the department, you actually trained me. For the past 6 years, I've been involved with the Substance Use Disorders Initiative team. And for the past couple years, I've been really involved in some of the racial justice work that we're doing within our substance use disorders team. So I'm really excited to be able to talk about different treatment options and things that we're offering, because I would really like to see some of my Black and Brown people come in and make sure they're being taken care of.
Absolutely.
There are lots of options out here for us.
And we're going to hear about them for sure. And so, Dr. Lambert, you referred to the fact of informing and educating. And in our email exchange, you noticed and you mentioned that words matter. So do you mind just giving a little context in your about the email response that you sent me about the word substance use and abuse?
Yeah, I think, when you look at the history of this country, and I'm talking from a federal response to dealing with individuals with substance use or substance use disorder, there's a history of negative connotation, implication, effects, criminalization of substance use among Black and Brown individuals in our Black and Brown communities. And that criminalization, that dehumanization has been perpetuated based on kind of how we describe these substance use and substance use disorders. And I would say, over the last 5 to 8 years, there's been a conscious effort within the medical community to really eliminate some of these historical, and I would say, quite frankly, racist terms when we describe substance use. One of those terms is substance abuse. We like to not think about individuals who have an issue with substance use as actually abusing the substance, getting away from that negative connotation, really focusing on the individual and not the substance. So we say substance use. If you think someone is having issues with a substance, we say they are misusing that substance. If it's impacting multiple domains of their life in terms of behavioral, psychological, physical, mental, occupational, relationship domains, then we start thinking about whether they have a use disorder, which implies a loss of control over that substance. And so those are the terminologies and terms we like to use because of the historical and negative connotation of some of these terms in the past. An individual with an alcohol use disorder is just that, a person with an alcohol use disorder, a person living with an alcohol use disorder, whether they're actively using that substance or in recovery, like some of the individuals on this call. And so we really want to reflect our words to use and mean what is going on with the individual who has an issue with substance or has a substance use disorder, and trying to ignore some of those historical negative words and terms that unfortunately this federal government has implicated and kind of caused to be imprinted in how we really treat our individual patients as individuals in person, first and foremost. So that's where I have a little bit of education. Trust me, I'm educating my colleagues who are physicians and healthcare providers on a daily basis. It's an ongoing process. I would tell you 8 years ago, I was probably using the same terminology until I became aware of kind of substance use and substance use disorders as a chronic disease that we should be treating just like diabetes or hypertension. We don't say a person with diabetes is abusing diabetes. We just say it's a person who has diabetes and this is how we're going to treat them moving forward. And so the same language that we use for all other chronic medical diseases, we should be using for individuals who suffer from substance use or substance use disorder.
Dr. Lambert, thank you. I'm going to come right back to you because you named ETOH or alcohol. But when Dia and y'all, well, I move organically in this space. And so when Dia, as someone who is very transparent about being in long-term recovery, can you just tell us the impact of what Dr. Lambert just said? Because words matter. And if you go into spaces and you're trying to get help, that approach, is that something that you think is helpful in demystifying or taking away the negative connotation from those that are seeking treatment?
Absolutely. I took the Recovery Coach Academy back in 2015. And even before that, we were talking about language and the stigmatizing words that we use when people are who have substance use disorders. So, when somebody goes to get a tox screen, it's always been they have a clean urine or it's a dirty urine. And people aren't clean or dirty. We're humans. And even on a spiritual level, when you talk about certain words and you say certain things, like I'm big on affirmations.
Yes.
So I don't, that's why I introduce myself as a woman in recovery. Now, there are places where people say I'm an addict, I'm this, I'm that. I don't introduce myself that way because I'm in recovery. I've been in recovery. And so that's what I need to tell my brain every single day. I am in recovery. You are in recovery. You're a woman in recovery. You're a Black woman in recovery. Like that empowers me. And so words do matter. Some of the words that, when we took the Recovery Coach Academy, we did this whole segment or module where we put up different words. So we put up the word addict, we put up the word, drunk or alcoholic, and we did word association, and there's no good words that come with that word association. So, really taking it as someone with a substance use disorder rather than somebody who does this, because that's not all they are. So even people who have substance use disorder, that's somebody's uncle, that's somebody's mother, that's somebody's brother, sister, cousin. And so we really need to make sure and humanize people. And even I would say in the notes that we use, it's still some of that, like making sure that we're humanizing people and we're not making people their diagnosis.
Thank you. Wendy, thank you. We're going to go ahead, Jazz.
Yeah, and just aside from even just in the medical field, just when we're talking to our friends, like what kind of words are we using when we're talking about people who use? Are we using the term like, oh my goodness, that person is such a crackhead, or a
fiend? Let's get 100.
You know what I mean? Meth heads. Like we really need to think about this stuff. And especially if we're really rooting for people to get better and to get treatment, having these negative associations is not going to motivate them to do so.
Jazz, thank you. Thank you. Dr. Lambert, you specialize specifically in alcohol use disorder. And so let's first of all just cover a little bit, and you all can chime in. Let's cover a little bit. There are types of substances. I was telling Jazz and Wendy, I remember my training from few moons ago, benzoids, opioids, alcohol, stimulants, depressants. What did I miss?
I would put tobacco on there, but
you're here. And so in our community, in many communities, Dr. Lambert, it's often referred, and I'll be very transparent. I was talking to someone this week and I was like, to help, have a glass of wine to relax. And so let's kind of have a little bit of this alcohol conversation, because I think it's again, I'm not in this field and not a professional, but just from my observation, that is one of the substances that can easily you can become addicted to it. Maybe not well, go ahead, because there was this whole conversation when the governor shut everything down, but he kept the liquor stores open. And a lot of people did not understand the reasoning behind that. And so, Dr. Lambert, if you could do a quick review of types of substances and end with alcohol and how we need to properly view alcohol.
Okay. You're giving me a lot there, Jimmy. So let me.
I know. I'm like, Jimmy, that's a loaded question right there. What's up?
That all the time. I'm accused of that all the time. So let's start with types of substances.
Yes. Let me preface what I'm going to say and support it with kind of what the national data, what's the trends nationally in terms of substances and substance use disorders, but most specifically focusing on deaths, which is one of the more prevalent and highly regulated and observed metric or outcome when we talk about substance use in this country. In terms of national trends, when you look at the U.S. Centers for Disease and Control Prevention, I'm talking when they last updated their data in terms of drug use overdoses in this country in November 2021. The period from April 2020 to April 2021, we're in the midst of the pandemic. We saw a nearly 30% increase in drug overdoses in this country. In the 12-month period from April 2019 to April 2020, there was about 78,000 drug overdoses in this country. That period from April 2020 to April 2021, again, in the midst of the pandemic, the number of drug overdoses increased to more than 100,000. Again, a 30% increase over a 1-year period. And I would tell you, the pundits say, oh, this is the effect of the pandemic. I would clarify that these rates were already going up before the pandemic. And then the pandemic happened, and what we saw was a tsunami of the already struggles that existed for individuals in this country with drugs. And so the pandemic was an opportunity for us to emphasize and highlight the inequities, the treatment disparities, and quite frankly, the racism that imprinted how we treat individuals in the country with substance use and substance use disorders. When we look in those numbers in terms of historical levels of drug overdoses in the country, embedded in that is that the majority of these deaths are secondary to opioids. And the opioid now that's predominant in a lot of market supplies, whether you're talking geographically, East Coast, West Coast, the Midwest, is fentanyl. It's more prominent in the Northeast, but it is because of a complexity in terms of how these drugs get into our communities is starting to increase in the West and also the Midwest. One startling fact, and please, just imprint this in your brain. Since 1999, when we started measuring and seeing the impact of drug overdoses in this country, since 1999, including up to year 2020, where I already told you about 100,000 individuals have died from a drug overdose in this last 12 months. More than 1 million people in this country have died from drug overdoses. And so we are now past an epidemic. We're past an endemic. We're at a public health crisis emergency. And the issue in terms of drug use deaths in this country and people in brown and black communities is that the overdose death rate, the mortality rate from deaths from drugs is narrowing. In fact, in 2019, 2020, drug overdoses impacting black and brown communities surpassed whites for the first time ever. Now, the changes have been ongoing in terms of increases compared to black and brown communities and white communities since 2013, 2014. But 2020 was the first time you saw that black and brown individuals were dying at a higher rate from drugs in this country compared to white communities. When you look about the percentual change from 2019 to 2020, that's a 50% increase in the number of black and brown individuals dying from drugs in this country.
Dr. Lambert, let me ask you, do
Sure.
you know, and I'm putting you on the spot kind of, but we were talking about alcohol. Do you know by any chance, and thank you for the stats, the percentage or have a guesstimate or just in trends of you being there, seeing, and Jazz and Wendia can speak to this too after Dr. Lambert, has alcohol either, they used to call it ETOH poisoning. Has that increased? It may not be considered an overdose, but where are we with alcohol? Because a lot of times I think, again, not an expert, but by observation and being 50 years old on this earth, that's one of the sneaky ones that if you're not careful, and especially in this pandemic where people were left home. And so what have you observed as far as the impact of alcoholism or alcohol use disorder?
So the pandemic has impacted individuals who struggle with alcohol or have an alcohol use disorder, right? When we talk about the pandemic, we talk about disruption to multiple domains of individuals' lives, work, increase in social isolation, those individuals who use alcohol or drugs to kind of live and get day to day to suffer, to avoid the suffering of chronic trauma, the violence impact on our neighbors, racial inequities, are drinking more.
Yep.
The problem is this is a space where the research is not as thorough and detailed as when we're talking about opioids. And that's specifically because nicotine, tobacco products, alcohol are legal. We know that they impact individuals who use these substances and develop an issue with them at the same rate or greater if we're talking about other drugs, including opioids. The problem is it's a legal substance. And because of that, there's a different way this country approaches alcohol compared to opioids. I would tell you the early data suggests the individuals who are drinking alcohol and don't have an issue with it are drinking more. The individuals who have an issue with alcohol, whether it's alcohol misuse or an alcohol use disorder, are drinking more. They're being admitted to the emergency room. They're being admitted to the hospital. They're developing alcohol-related diseases, whether it's end-stage liver disease or acute alcoholic hepatitis that requires them to be admitted to the hospital. The rates of those are also going up. We won't know the true impact of the pandemic on alcohol use, misuse, and alcohol use disorder until probably the next several years. The data we get about alcohol's impact on this community and this society and this nation is a little bit different than the data we get on opioid impact on individuals in this nation. And so that disparity in how we get timely, real-time data to see the impact of alcohol, especially during the pandemic, is a little bit slow and lag. I can tell you from a clinical perspective, I see more individuals in the hospital suffering from problems from alcohol or have struggles with their alcohol use disorder, more so since the pandemic. But again, I want to tell you, these issues existed before the pandemic. The pandemic has only been an opportunity for us to see the impact, not only in white communities, but especially in our Black and brown communities.
Dr. Lambert, thank you. And I just want to be sensitive that you have two testosterone holders here on the top. We want to make sure we incorporate our sisters as well. But Dr. Lambert,
those are my great sisters. Yes.
Yeah, we know when to jump in, Jimmy. But
okay,
I appreciate because he's spitting facts right now. So
yeah, we need that piece too. So I think it's important to have those factual data and then the anecdotal data too.
What is that, Wendia? What is the anecdotal data of what you're seeing right now? And we can transition from alcohol into just trans. And Dr. Lambert, you can jump back in because there are some changes in either the amount or the access. And then I already have a question here. We're going to take more questions in about 10 minutes, but fentanyl, lace, marijuana, fake, so Wendia, thank you for affirming, and Jazz, the facts that Dr. Lambert shared with us. Anecdotal from what you both are seeing either in the clinic or in your coaching processes with folks. Wendia, take the stats and break them down to us in, as Dr. Lambert said, in a human experience, from alcohol to opioids to wherever.
Yeah, I think, when I first started coaching, I didn't realize how detrimental alcohol was. It wasn't until I was, coaching this woman and I saw her on a Friday and her skin was really yellow. And then I saw her on a Monday and it was even more yellow. She was really jaundiced. She was really, really jaundiced. And I didn't realize how much alcohol is so terrible. And, we did have to keep liquor stores open because you can die from alcohol withdrawal. You can die from it. And so, I know people were like, why do they get to stay open? And, there's sometimes this whole thing in, I think, our communities where we're like, well, what about us? There's that what about usism, right? Yep. And we need to realize that fentanyl, I saw a comment, people were asking what fentanyl is. It's an opiate, but it's a really strong opiate that's really causing a lot of, so there's not too much heroin out there anymore. Now it's fentanyl, and it's synthetic fentanyl. And so people are dying from that. And there's so many Black and brown people that are using opiates. Even our young people are using opiates and using it in a way like using it in drinks
like lean and things like that
and all that stuff. And people are using opiates, but not realizing that you can have an overdose, an unintentional overdose. And that's where this is coming from. A lot of people aren't educated. I think from the human side, there's a lot of like issues in the what's the name of the
No, I didn't mean to distract y'all. Go ahead with your thought. I'm sorry.
Distracted. So there's a lot of education I think that people need around opiates and how to stay safe, and where to get Narcan from, and that Narcan isn't a bad thing, and that we need to make sure that we're keeping our community safe. But the human part of it is that I have seen a lot of people drinking more. When the pandemic started, a lot of people drank more. A lot of people that I knew personally who had years in recovery ended up relapsing, which was like really hard to see. The coaches, that the people that they were dealing with, again, people who were stable in their recovery, the pandemic hit, and then that was it. And that's due in part to, I think, when you're in recovery and you have community, you're able to see those people, you're able to like get a hug. People are, they're going to meetings, all the meetings shut down.
Yep.
Even being able to go see your provider, that's been different. So there were so many changes that, it just takes like one thing, or it takes like a few things, that perfect storm, and then you're like, screw it. And, alcohol is the easiest thing to get access to. And so I definitely have seen an increase in people that I know even using alcohol at home. I've had people inbox me like, I don't have an issue, but I think I might. Those kind of things are popping up. People.
I just want to piggyback, Jimmy, off of Wendia really quickly when we talk about the increased rate in alcohol. If you're in Black and brown communities, there's a liquor store on every single corner. Okay, so when we're talking about some of these things, like our communities are always getting hit the hardest, so we talk about this thing of like the what about us ism. We have to start caring about ourselves also, and think about ways that we can change within our community to better ourselves also.
Yeah.
Jazz, thank you. Dr. Lambert, I saw you nodding your head in the amen corner a few times, sir. Anything to add to that? And then we're going to go into some of the unfortunate.
I think Wendia is right on point, right? Someone in recovery has created a life that resembles some degree of normalcy without that substance. And what the pandemic did was disrupted those lives they had created that reflects their own normalcy. They were thrown back into, how do I cope with this disruption? And the normal resources that they were able to take advantage of, meetings, social touch, talking to individuals who know them, were gone in the early days of the pandemic. And not only was that social network disrupted, their provider networks were disrupted. They couldn't go and talk to their providers in person. Resource programs, treatment programs were trying to get upgraded on telehealth, and that took months for certain programs. And so those disruptions in the early part of the pandemic, which are better, but not where they were before the pandemic, put a lot of individuals who were in recovery doing well at risk of returning to use, and that's some of what we saw. And then another point, what Jazz was saying about alcohol, I don't call them liquor stores. I call alcohol repositories. The density of those are correct when you talk about Black and brown communities. The density, we know this, the density is on order of many multifold compared to white communities. Yep. You could go over to Brookline or Newton and see, there's one liquor store, okay. And then you go to Mattapan and you see one every block, right? And so that's a historical, social, cultural manifestation of some of the racist policies that the federal government implicated for Black and brown communities. I'm not only talking about substances including alcohol, I'm talking about housing, access to healthcare. The pandemic highlighted some of those disparities that we have known existed for some time. And I just want to make one more point when we talk about the different substances, benzodiazepines, cocaine, methamphetamines, use of which all are going up during the pandemic. But again, we're increasing before the pandemic because of the explosion of synthetic fentanyl in the drug supply, especially here in the Northeast. One telling fact, and I'm not one to quote from the federal government, but the DEA in 2020 seized 9.5 million fake pills. These pills could have been anything: benzodiazepines, a stimulant for ADHD, and 2 out of 5 of those pills they seized had a lethal dose of fentanyl. So you might think you're buying Xanax or benzodiazepine from your friend off the street, but because of the alteration of the fentanyl use supply, fentanyl is not only just used in fentanyl alone, but it's unfortunately in every substance that an individual could actually try or be exposed to. And so that's why the message is clear. Think about the source of your drug use, wherever it comes from, because fentanyl, if you're talking about pills, is in 40% of those pills at a lethal dose. And so if you never use fentanyl and you're going to buy a Xanax pill for your friend, keep in mind that Xanax pill in 40% of the cases has fentanyl at a lethal dose. And that's also contributing to some of the fatal and non-fatal overdoses we see in the last 3 years.
Dr. Lambert, we're going to have to do a part 2 because there are some questions and I want to incorporate them. And we're not shifting as of yet because I want to hear from Wendia. Again, that update that Dr. Lambert gave from a clinical and stat standpoint, Wendia and Jasmine, what is the human impact? I know I've heard of folks that have passed in the past couple of years, and there is this, there was rumors, I heard that they got some lace weed, or I heard that they, did this or whatever. And not only is it Dr. Lambert, if I heard you correctly, the authentic fentanyl, but you started that statement talking about the DEA seized 9-point-something million pills across the board, just fake pills, period. And so, and I also heard something from you, and Wendia, I'm coming right. I heard a harm reduction, and I know that in certain spaces is an interesting word, but you said, and we want you alive, and there may be legalities and stuff, but you said kind of know the source from which you're getting your drugs. Now, use a clinician, and I love your cadence. You're keeping it 100, but Wendia, would it, maybe the doctor can't say certain things, but Wendia, from a harm reduction outreach standpoint, please take us to a whole nother level based on what Dr. Lambert just shared. And Jazz, jump in as well.
I mean, we want people to be alive. Like, that's the bottom line. We want them to be in recovery. There's a question in there about, like, are people always in recovery, or are they recovered? But there's a spectrum, right? And so there's some people who are not going to be completely abstinent. They're not going to be completely abstinent, and that's okay. But what we want them to do is, yes, some people who decide that I'm not going to completely stop, we need to make sure that they can stay safe. Harm reduction, if people can't get with it sometimes, harm reduction is wearing your seatbelt. That's a form of harm reduction.
Condoms is a form of harm reduction.
Condoms, and so when it comes to substance use disorder, when it comes to alcohol, and you're trying to help somebody with harm reduction around that, you may tell them, try to cut back a little bit every day. Try to water your alcohol down. Drink Gatorade with the alcohol or something. Make sure you stay hydrated. When it comes to, like, opiates, you do want to make sure where are you getting your supply from? Make sure it's the same person every single time. Make sure you do have, if you're injecting, because not everybody injects, make sure that you have clean needles and all of the things that you need.
And often there are, like, little testing kits that come in, like harm reduction kits also, so that you can test what you're using before you use it. Also.
Yeah. And so those are the things that are important, and I know sometimes, again, people just want people to stop. They want them to stop completely, but that's not the reality for everybody. I've worked with people who say, you know what, I will stop, using heroin and coke, but I'm still going to smoke weed. And I still educate them, like, make sure you know where you're getting your weed from. Make sure that it's still a safe supply. If you can, go to a dispensary, because at least you're going to be getting something safe. And so it's really important that people understand harm reduction from a standpoint of keeping people alive, and not what they call enabling people. We have to get out of that mentality. Go ahead, Jess.
I think in our community too, and I'm from Dorchester and I'm from Roxbury, you hear harm reduction and the first thing you think is Why do they keep bringing needles into our community? I know it's a touchy subject, I get it, but that's not just what harm reduction is. Harm reduction can be Narcan. If your family or friend member overdoses, you want to be able to provide them with Narcan so you can bring them back to life. The point in all this is keeping us alive. And I'm in this space every day, and the majority of the people who are coming to get treated with some of these life-saving, treatments, they're all white people. And I'm like, we have all these options. And in my community, I'm just hearing people to say, well, you just need to stop, or this is how you should do it, or abstinence is the best. And the bottom line is that there's not one form of treatment for everybody.
Let's just also name another point of harm reduction, and MGH is doing this actively. An example is this show here. We have to also acknowledge, and Dr. Lambert has been kind of teasing this, that there are system and structures within the healthcare system, let alone, so there's the general healthcare system, and then there are the presumed stigmas that come in. And then if you go, let's keep it 100 in Black and brown communities, there's the fear. And I'm going to be very real here. If you go seeking addiction treatment and you got children, the mom or dad has to worry about it. They're going to file a 51A and whatnot. So Jazz, I am with you on us taking advantage of availability of services, but we've talked on this platform many times, and Dr. Lambert named it today, and you all have as well. There are systematic structures that if someone even gets to the point, I need to go and check Jazz out, they come down, they come on campus, and one little wrong interaction, and they may turn around. So we have to name that there are limitations as well. And so, Dr. Lambert, I'm going to come back to you, and now maybe we can begin, because I want to take some questions, but and we have to do it. Dr. Labre, if you're watching, you need to reach back out and get them scheduled for a follow-up. From a clinical standpoint in treatment, you talk about a lot of times you may see these folks at sort of the most extreme, urgent end. What are some of the clinical things that are in place that are treating addiction?
So treatment and whether effective treatment exists, and I'm talking treatment in the broad spectrum, right? I'm talking about the spectrum that involves harm reduction, those individuals who aren't ready to stop abstaining or stop using or stop reducing their use, all the way to the other end of the spectrum where we're talking about the severity of their substance use, whether it's opioids or alcohol, requires a more intensive intervention, including pharmacotherapy. There are medications that can help with.
Can we just break down what I know what it is. Pharmacotherapy is what?
It's actually medications for substance use disorder. And so there are FDA approved life-saving, life-preserving medications for opioid use disorder. Those include Suboxone is a trade name, but it's buprenorphine. And it includes one of the more historically checkered medications when we talk about Black and brown people, methadone. But those two medications save lives. And so if you have a severe issue with opioids, it's in your best interest, one, to make that first step. And it's always about the first step. And the first step involves saying, I think the substance I'm using, whether it's opioids or alcohol, is starting to impact my life. It's starting to impact the lives of the people who I love. It's starting to impact how I live day to day. If you start to make that realization, then the hope is you can start thinking about talking to somebody about your substance use. And that professional, myself, including other individuals in addiction medicine, can make a clinical decision and judgment on whether the substance you're using is resulting in a substance use disorder, again, the far end of that spectrum, or it's on the other end of the spectrum where it's just unhealthy use. And your use is not impacting your lives, but it might put you at risk for negative consequences of your use. And so really having an open, frank conversation, ideally with your primary care physician. And we are now in a space in terms of how we provide care to these patients, that if you can't find a clinician who wants to engage with you about your substance use, a clinician who makes you feel not judged, a clinician who is going to be supportive and meet you where you are and try to create an intervention or a plan to help you address your substance use, if you're ready, then you need to find another provider. And that's why you need to come over to Mass General. And that's why we're doing
That's
this.
right. Put the plug out there, Gene.
And I want to put a plug in too, because one of the things I've been with Mass General Brigham since 2016 in different positions, but I will say the SUDS initiative. So SUDS is substance use disorder.
Yep.
The SUDS initiative is really taking a hard line on racial justice and racial equity. We are not playing any games when it comes to that. If somebody does, because I want to go back to what you said about like if they come to Mass General, you know, and they're stigmatized for their substance use or because of racial issues, we're escalating it. We're not letting it just like, oh, I'm so sorry that happened to you. No, we are getting people involved. We're getting like the president, whoever involved, because we understand, you know, what I said was Mass General has a reputation of being like a rich white hospital.
Mm-hmm.
And, you know, like Jazz said, a lot of people who are coming in to get treatment are white. And we are trying now actively to figure out why that is. So Jazz and I are going into the community. We're talking to different organizations in the community, figuring out, can we work and do some sort of collaboration with Mass General and the community, the Black and Brown community specifically.
Yeah.
Specifically, we are really working towards this because we also pull data and we see, you know, who we're serving, and we're not serving Black and Brown people right here in Boston.
No. And it was, sorry to interrupt, it was important for us to do the community needs assessment first, because I think a lot of times what happens, and especially with MGH, is we have this like white saviorism thing. I'm going to go into these communities. I know what people need. We're going to save them. So, right, there's a pause there. We're going to go into the community first and say, what is it that you guys need? And then we'll be able to say, okay, this is what we can do to help people.
Mm-hmm.
Yeah. Based on what you both said, and I don't work for MGH, and so I'll be the one that gets in trouble. But is there an opportunity where you all, because let's keep it 100, coming in that area, I believe West End is located down somewhere near the Garden or not too far from Mass General. I'm saying, is it still the Garden? I'm old. But you know, is one of the things, if anyone is listening, and I'll say this to get you all to support because you're probably working on it, there also needs to be some sort of satellite to where, and not in a, because I know there's also a movement of decentralizing services. And so it would behoove MGH to support you guys being able to come a little closer to Black and Brown communities physically, because then you eliminate the potential of someone not wanting to come from what you just named. And we've talked about this on the show early in the beginning before when we started this partnership about MGH's unfortunate early reputation, actively working. And based on the stuff I'm hearing today and from you all, if you were seeking addiction counseling or services, these three folks here, what I'm gathering from them, you definitely need to reach out. But is there an opportunity? I would just share with MGH that it would behoove them to ensure that they support getting you guys closer into the community for those available services. We have a couple of questions. We have about 13 minutes left.
Can I jump in before you say questions? Because yes, there is a huge need. There's a want for MGH to come into the communities, but we first need to make sure that that's okay with the community first.
That part.
Mm-hmm. Yeah, and we're on it.
And thank you for that. But Jazz, we know that there's the need, and then there is also we have to be. And one of the things I want to talk about, or maybe end with today, is I've seen, and Dr. Lambert started with this. I've seen a lot of chatter and words matter, to where, and I'll be fully transparent. I've had family members that have dealt with alcoholism and that have dealt with crack as well. And so I've been guilty of, well, why not? Just stop, make the decision. You're not doing it. But we got to understand that in some respects, Dr. Lambert, and I'll go to resources after this, that there is a maybe the first time, for whatever reason, someone made a choice to use. But can we understand that there are some substances that once they're first ingested, there is a brain chemical, something that takes place. My understanding that some of the drugs, the reason that people are still going after and using and become so aggressive, because they're looking for that first high. for lack of better words. And so, excuse me, I know we have to get the resources, but either one of you, all of you, can you just talk to that human bit while we get ready to talk about resources? Whoever first, it don't matter.
I mean, I'm not in recovery, but I have a family full of people who suffer from substance use disorder. I mean, my whole family on my father's side has been completely wiped out. And it may not necessarily be an overdose, but there, like Jean said, there's a lot of things that come with long-term years of drug use and alcohol, use. So I just want to make sure that whatever I'm doing in this work that is supporting people who look like me, because my family didn't get that opportunity. So I'm here to educate myself as much as I can, and so that I can go and educate my community so we can really get this thing going. You can't just say no sometimes,
Yeah.
Yep.
Somebody
just put that in the comments. Yeah.
This is a nice opportunity to educate about addiction. And it's one of the words I do use, because when you look at a brain level, the substances we use in this country, whether it's nicotine or tobacco or alcohol, which are legal, or not legal, opioids, methamphetamine, cocaine, when they look at studies in individuals who use these substances, what they see is the level of dopamine, which is a neurotransmitter that makes us feel good. When I look at a meal at McDonald's, I see that Big Mac, dopamine's a fireman. I want to get that Big Mac. The problem is these substances increase the levels of dopamines 1,000-fold. There's nothing that can compete with those substances. And so the first time you use a substance, you are astonished with how good you feel. The only issue is the longer you use these substances, the brain chemistry undergoes a neuroadaptation that unfortunately is not beneficial for you in the long term. And so you continue to use these substances to chase that euphoric feeling, and you start using more and more substances to the point where now it's not about chasing that good feeling, it's about trying not to go into withdrawal. So you continue to use the fentanyl, the heroin, so you're not going into withdrawal. You continue to drink large amounts of alcohol so you don't feel like you're going into withdrawal. And at that point, because of the changes that have occurred in the brain, we start saying that is clinically equivalent to having an addiction. You need to keep using these substances so that you don't feel bad, you don't have withdrawal, and you're actually able to function, even though anybody could look at you and say, you're not functioning, my friend, normally. And so when we talk about addiction, and this is why if you feel like you have a loss of control over any substance, including alcohol, you need to start talking not only with yourself, with your family, with your providers, about what that looks like, and get an accurate clinical decision about whether it's impacting your life in a negative way that no longer, if it continues, is only going to provide more negative consequences. And that first step, just saying, do I have a problem? Just ask yourself that question. Do I have a problem with the substance that I'm using? And if it's like millions of people in this country, the answer is no, then the answer is no. But for a minority in this country, if the answer is yes, you really need to start thinking about, how do I get help? Because I do have a problem, and I'm starting to recognize it's a problem. And that's why we came out today. When we say MGH is white and rich, I don't care. What I do care about is that they have the resources
Right.
that we can help our Black and brown individuals in our communities if they're willing to try to start talking about the substance use and the problems they have, and if they're interested in starting to really seek change in their lives. Because Mass General is well-resourced, well-funded, we have the resources. And I'm not saying our resources are outstanding, we're not challenged, but we're in a different place culturally at Mass General where we know we need to do more. And you can tell by the individuals on the call, we're all Black.
Yeah, yeah.
When is the first time you've seen 3 Black providers?
And we're all in leadership roles too.
Talking about substance use.
We're all in
Mass
leadership.
General has made a commitment to make sure that individuals who in our Black and brown communities want to start thinking about getting help are going to be confronted with actual Black and brown providers who understand the historic implications, understand where we are in terms of substance, how they impact our communities. I know some of the comments talk about, my family member was incarcerated. Yeah, we abhor the criminalization of any substance use.
Yeah.
Cannabis, opioids. And so we are in a different place. I can't speak about other centers or healthcare systems in the state, but I know where we are at Mass General, and we welcome anybody coming to our doorsteps to talk about their substance use, and doing so in a non-judgmental, non-critical, non-punitive way, and just meeting individuals where they're at, having a conversation. That's where it all starts.
Dr. Lambert, thank you. We want to go into resources, and I'm going to put one on the screen in a minute. So, Wendia and Jazz, someone gets to a point where Dr. Lambert named, they're ready to make that first step. What are some of the resources available, particularly there in your shop?
Well, Wendy, I'll start with this one. I just want to put a plug up for our Bridge Clinic. So we are a walk-in clinic. You can walk right in off the street. You don't need health insurance. You honestly don't even have to be registered with Mass General. If you walk in the door and you say that I need help, I have a substance use disorder, we'll get you registered right there. I know some people talked about not being able to, you don't have insurance, right? So if you come in, that's a barrier that you don't even have to worry about. We're open 9 to 5. But you can make an appointment, but if you want to walk right on in the door and say that you need help, we'll make sure that somebody treats you same day.
Thank you. And it's interesting, Jazz, because we talked about the training, and we do have to name and recognize, even if everything was perfect and 100% at the hospital, sometimes you have to go through and someone named the insurance tends to be a challenge, because I believe this treatment, and you got to get diagnosed and DSM 5 or whatever, in order to get your insurance to approve a certain amount of visits. Then you got to go back and get a reauthorization. That's the stuff that Jazz and I worked on a few years ago. And so we just want to name that Jasmine just named, that this is the Bridge Clinic number. And you don't have, if I understand right, you don't have to have insurance, and you can reach out to them to get connected to services. Wendia, what are some other resources that are there at Bridge, and or if you know of others? I'm happy to share.
I mean, you could do a show by itself about resources, but
Let's do it.
The resource and the intervention that we use at MGH is recovery coaching. And so we have currently 12 recovery coaches in different locations, and the Bridge Clinic has a recovery coach there. He's been there for many years. He's also a person of color. And so we have recovery coaching, and recovery coaching is people with lived experience helping people who are on that spectrum that say, I might have a problem, I do have a problem, and they are ready to engage. Recovery coaches don't tell them what they need to do. They're a person who walks with them in recovery. So as I'm in recovery, I can say, hey, I've been here. I kind of know the way out. Let me walk with you on the way out. And it's really, kind of a newer intervention, especially in clinical spaces, but it's peer-to-peer. So we only hire people with the lived experience. We hire people who may have quarries, and we've worked really hard. We've worked really hard to say, hey, this person has a quarry, but let's try to get them in anyway. You know, if it's been X amount of years, if it's X amount of charge, we understand that. So we're really working again, you know, to provide recovery coaches with, or to provide people with this intervention that's really, really wonderful. Recovery coaches can meet people in the community. So again, if you are a coach and people don't want to come in, the coach can meet you where you're at, you know, literally and figuratively meet you where you're at. So if you're, again, in this place where I don't want to stop using, or I don't know if I have a problem, the coach will meet you where you're at and start working on you with you towards goals. So it may not be that the coach is telling you, like, the coach is not going to tell you, oh, well, you need to stop, but the coach will say, well, what goals do you have? And if you notice that the substance use is getting in the way of your goals, then it kind of just organically happens that you as a person will start to feel like, well, I probably should stop using because this is getting in the way of my housing or getting a job or getting my kids back or whatever the case might be. So it's really, I love recovery coaching, near and dear to my heart. I think we need a recovery coach for anybody who has a substance use disorder. I noticed that somebody talked about, you know, incarceration being a way. Like, a recovery coach can advocate and help advocate with you around, you know, if there are some things happening with legal systems. Again, they can meet you in the court. I guess I'll put a plug in for also the helpline, the Massachusetts Substance Use Helpline. And that number is 800-327-5050. And that's a phone line that has people who are working on there, some people in recovery, some people not, but they're all really well informed about different resources across Massachusetts. So whether you want to get into detox, whether you want outpatient counseling, whether you want medication, the helpline can also help with that. So that's just kind of a overarching resource that people can touch base with.
I'm just going to ask you all to get ready for closing statements. I am making sure, and I usually tell people, Wendy, Dr. Lambert, and Jazz, that take screenshots, of this information if you don't have a chance to write it down. And if you know someone that is dealing with this in a non-judgmental manner, just send them, a screenshot of this or whatever. Don't be too intrusive, but there is information out here for those, as Dr. Lambert said, that are ready to take that first step. Jazz, is there anything we missed as we get ready to close out?
No, I do want to say though, Yahara made a comment about how there aren't a lot of culturally safe spaces for people who have substance use disorder, and that's true. So we are looking to hire a social worker and an RN in our clinic who is a diverse candidate, so that our people can come in and have people treat them that look like them.
So if you're a social worker or you're a nurse that is BIPOC, and it would help if you have some recovery coaching or experience, reach out to these folks here because they're looking for you. Wendy.
Oh boy, I have so much to say. I guess in closing, there were so many good comments. I want to shout out Heidi and
Yes.
Sorry for her loss.
I was actually going to ask you to speak to that.
Yes, there were a couple questions. She mentioned the incarceration, and that's why we are totally against incarceration for people who have substance use disorder, in terms of like just being incarcerated for that.
As she said.
There's resources for families. Again, if you call the helpline, you can get those resources for families if you're struggling. But what I will say is that we really need to destigmatize substance use disorder. We really need to, as a community, wrap our arms around people who are experiencing substance use disorder. We don't want to push them out of our communities. These are, like I said earlier, our uncles, brothers, cousins, sisters, mothers, and we really need to wrap our arms around them. Like I said, recovery coaching is near and dear to my heart. There's a recovery center right in the heart of Roxbury that's going to be reopening. It's called Step Rocks, and that's a great place for you to go and volunteer or send your loved one there if they're in recovery and they need community. I really believe recovery is about connection and it's about community. And so once you decide that you want to do something, then you got to get your community around you as well.
Thank you. Dr. Lambert, take us home, sir.
I would tell you, this is a fantastic conversation, but I would tell you there's a term we use when we talk about the opioid epidemic that has been whitewashed, right? All you see is white individuals, white faces of this epidemic. And I would tell you, unfortunately, Black and brown communities always get, I wouldn't even say second helpings. We always get the last of what's needed in terms of support, whether it's federal or state. If this will continue, what we really need to emphasize is that our Black and brown communities are struggling at a worse rates than white communities. And we need resources more than they do. But we also need, as a community, to come together and you have a uniform voice saying, this is what we're struggling with in our communities. This is the help we need. Here are the faces of this epidemic. And it's not white, it's Black and brown. And so once we have that uniform message, we can start asking our state legislators, the people who actually distribute the federal and state funds, that this is what we need to help our communities prosper. And more importantly, abate and mitigate the intergenerational trauma that exists, because my parent used a substance, I'm using a substance. Guess what's going to happen with my children? They're going to be at a higher risk to use substance. And we already know from hundreds of years of racism That's why we struggle as a community in terms of equity and being on par with a number of healthcare indicators when compared to white communities. But the voice needs to be loud, it needs to be one, and it needs to be today when we're talking about what we need to treat some of these devastating substances and their impacts on our communities.
You told him to bring it home, Jimmy.
Listen,
Jazz knows me and knows I have the propensity. And if Dr. Alabri was on, this would be one of his moments, because y'all know I may be a host now, but the activist in me just rolls up because you spoke to more than just the issues of substance, Dr. Lambert. So I look forward to having you guys back. I think especially, and tell me if I'm wrong, as we're approaching the summer. I don't know if you know if alcohol use, I believe, will go up during the summer, and maybe other spikes in use. But thinking maybe right before the summer, if we can have you guys come back. I really appreciate all of you. And I will say, if you indulge me for one more minute, today was the last episode of the pilot here with MGH. Dr. Betancourt and the team, they're kind of waiting on me. Mass General Hospital has committed to going into full contract with this segment. And so we're going to keep going. They're just waiting on me to get the paperwork over to them. And so it's coming, Natalie and Dr. Betancourt. It's just one-man show, literally, sometimes. But I think it was so apropos that we closed out, because there have been challenges. Dr. Lambert, you named that. I think this is the first episode. No, we've had a couple of other episodes where there were all Black providers here. Dr. Ronke, Dr. Fatima, who I'm sure you all are familiar with. But I think it was so awesome that you all are closing out the pilot with such passion, with such information, with such demonstration of MGH's commitment to racial equity by everything that exuded out of what you all said today. And so that Suave commercial, hope it's spreading to other departments, so on and so on and so on. I'm going to let you guys go. I do have to, and you all feel free to, you all participants. I want to ensure that we are doing well according to the viewers. And so I need you guys to do me a favor that have been watching Your Healthy Java since October 26, 2021. Go and take this survey for me, all lowercase, case sensitive, jwj.info/YHJ survey. Please go and take that survey, because I do want to let Mass General know that they're having an impact. Just this conversation here today. I'm sure you all are going to get calls and reaching out. And Wendy, thank you for affirming. Heidi as well. But please go take this survey, and I will end in making sure that the information, take a screenshot of this and get it to someone, and take a screenshot of this and get it to someone as well. Thank all three of you. I'm going to go pay some bills, and I look forward to our second conversation. Dr. Lambert, I'm putting together a COVAC Black conversation, COVID, the vaccination. I'm going to reach out to you for some
Please do.
Some off hours appearances on Java with Jimmy.
Please do. I've gone to many of the Department of Correction facilities and talked to inmates about vaccine hesitancy education. So please, it's a space that I'm currently doing work in. So.
Oh yeah, I can see it, sir. This isn't going to be our last time nor subject on screen together. Thank you all.
Thank you for having us, Jimmy.
Absolutely, and give Daniel my best. I see he's in the room.
The whole family's up in here. So.
I know. I was like, oh, that's cute.
Talk about self-care and love. Shout out to Loretta and Daniel and Adele Irving, who's a Java family member as it is. And so thank you all for being here today. I'm going to go pay some bills, and we'll talk soon.
Thank you.
Have a good day, y'all.
Bye-bye.
Listen, everyone, that was one of the most comprehensive, informative, I would say mobilizing too, sessions that we've had since we've been doing the Your Healthy Java segment. And so please, I'm going to put the survey back up, Leslie. Please do me a favor so MGH can see, not just through my words, and sometimes the numbers fluctuate, but the survey is 8 questions. The first 6 are multiple choice. And in the last 2 questions, you can give us some advice about what would you like to see, what subjects would you like covered. So please be sure and go ahead and take that survey for me. It was definitely a powerful session. And thank you so much, Dr. Betancourt, Natalie, Connor, Cindy, Dr. Alabre, Geneva, all of the folks there in the Office of Health Equity and Community, the Office of Equity and Community Health. Thank you all so much. I look forward to the next 6 months to a year. Thank you so much for the support of the initial pilot and moving into full contract in support of this segment. It is much appreciated. We're going to get the survey filled out and get it to you guys. And then I'm going to get the paperwork I need to get over to MG8 so we can solidify things. But it's been an awesome 6 months. Dr. Alabre, I know you're watching. Thank you, sir. Thank you. Thank you. Thank you. And look forward to having some in community, your healthy Javas, and folks can get to meet you and see you. All right, everyone. Have a wonderful day. Tomorrow is Wednesday. We're doing our first on location show at 9 a.m. at NCAT, New England Culinary Arts. Y'all forgive me. You'll find out tomorrow. Tomorrow at 9 a.m., bright and early. I'm going to be there about 6:30, 6:45 because they start. They're cooking for your boy tomorrow. And so I'm going to have some shrimp and grits and catfish. And so we'll be there early in the morning and we're going to hear from NCAT. And so wonderful that this program actually works with those that are dealing with substance use disorder. A lot of them, those that have been incarcerated, they have a wonderful program that they're doing at South Bay with Sheriff Steve Tompkins. And so that'll be tomorrow at 9 a.m. And on Thursday, if you all remember Exit Fame, a rapper from Boston who is a man of faith, an awesome lyricist, he's coming in studio here on Thursday. His album is being released on the 22nd. And so he's coming in on Thursday. Wednesday is 420. And I'll leave that right there. All right. Have a wonderful day, everybody. Thank you all so much for tuning in today. And we will see you tomorrow morning. I see a few comments. Let me go check with those first before I get out of here. See, y'all going to have your own conversation in the Java Cafe. This ain't for me. Let me just make sure I didn't miss anything. Heidi, thank you for putting the link in there. Thank you so much. That's the link for you all to do the survey. I think I got everybody. Leslie, thank you. Wendia, thank you. Y'all, I appreciate y'all so much. This was definitely a powerful session. Wendia, thank you for coming. And Key Marie, there it is. Someone did put it in the chat. So thank you all so much for the love and support. Appreciate you. We're going to keep percolating in this space, guys. So have a wonderful day. And we will talk with you tomorrow morning from NCAT. Bright and early at 9 for y'all, but I'll be there earlier. Have a great day.